Hey everyone, come on into our little hideaway. It's a cozy little treatment room down on the third level of our 4-story cliff house here at Therapy on the Rocks, right on the banks of Oak Creek. Today what we want to do is give you some treatment techniques for the label of headaches. You know, a lot of people around this time of year are complaining about having headaches, and they usually associate them with some of the environmental conditions that kind of happen at springtime and early summer. Increased pollen, barometric pressure with storms, and even the heat. And nowadays, because of the current situation we all find ourselves in, more and more people are having time at home on their devices, and they're complaining about things like Zoom fatigue or Skype fatigue. So what we wanted to do was to show you some ways that you can actually address the label of headaches regionally as well as full body. Because we're going to be doing some techniques that seem like they're just focused on the fascia within the cranium, I just want to make sure that you remember that John talks about that the fascial system is a full body glide system. Quite frequently symptoms are in one place, like headaches, but the cause can be somewhere else. So what we're going to do is go over a few techniques for the regional cranial fascia, and then we're going to show you a technique that, a full body technique that actually gets into the fascia in a bigger way. So what we're going to do is we're going to go over a handful of techniques. I just want to remind you, for all the techniques, you want to hold them for a minimum of 5 to 7 minutes so you can get the maximum benefit from all of these techniques. John has always taught us that one of the basic principles is to follow the releases for a minimum of 5 to 7 minutes. So all the physiological changes that are going to happen will actually occur. Also, if you want to practice these techniques with me, what you can do is watch me demonstrate the technique, put the video on pause, do the technique, and then come back and press play and come back and see what the next technique is all about. The first one I want to go over is a hair pull. That's one of the first things I always think about whenever people say that they actually have headaches. John teaches this one at MFR2 and also has taught it as a self-treatment technique at the healing seminars. And it's exactly what it says. What we're going to do is pull our hair. We're going to take our hands, and what we're going to do is grab our hair real close by the roots, and then we're going to gently, without over pulling, pull the roots away from our scalp. We're going to explore our head to find out which area that the hair pull is the most effective, where it feels it has the most tenderness, where it seems to be pulling in to wherever your headache actually is in your head. Once you find the spot that gives you the most relief, then what you can do is place your elbows on the table and follow the releases and the holds from this position. So our next technique is a tantorum cerebelli technique. This is a great technique for patients who complain about tension headaches or having that vice-like pressure inside their head. And what we're going to do is we're going to exaggerate that compression within the system to help hopefully get some relief for our patients. The way that we actually do this technique is we take the heels of our hands and place them above our ears with our fingers pointing up toward the sky. We're going to gently but firmly compress in toward midline, toward the center of the skull, until we feel we hit some resistance. And then we're going to lift up toward the top of the head. When we feel we've gotten the barrier there, when we feel we're at the right amount of resistance, we can place our elbows on the table and then allow ourselves just to follow these releases, going wherever the head goes and stopping wherever it stops. So our next technique is the ear pulls. John teaches this at MFR2 and has turned it into a self-treatment technique that he actually shares at the healing seminar. Ear pulls are great for affecting are a great way of indirectly affecting the orientation of the temporal bones, because when they're out of balance, they can cause things like vertigo, headaches, tinnitus, and a myriad of other symptoms. The way that we actually do this is we use a little pincer grip with both of our hands, and we grab the pinna of our ears. And what we're going to do is we're going to pull our ears out until we feel resistance. Then what we're going to do is we're going to pull our ears down toward our shoulders until we feel the barrier there. And then we're going to pull them back toward our back so that we get the three-dimensionality of the web. Once we've done that, we can rest our elbows back on the table, and what we can do is just allow for this release to occur. what you're going to feel usually is that one ear is different than the other. But eventually, as you sink into it and allow for the time barrier, or the time to go on, what you're going to start to feel is the webs start to release, maybe from the ear, through your face, and definitely down your neck. So the sphenoid release is the next release that we're actually going to go over. And John actually teaches us at MFR1, and then he's turned it into a self-treatment technique that he shared at a variety of different classes. The sphenoid bone is a very important bone. It's a winged-like structure that lives deep in your cranium behind your eyes. And it actually articulates with 9 other bones in your body. So it makes up part of the orbits of your eyes. It also makes up part of your sinuses, and even houses the master gland of your body, the pituitary. So we actually use the wings of the sphenoid, the outer aspects, for this technique. The way that you find the wings is you're going to place your fingers just lateral to the canthus of your eyes into this little soft spot. And you can use 1 or 2 fingers to connect in. And then what you're going to do is gently compress in until you feel the bone. And then without sliding, nudge those wings back toward the back of your head. Allow a few releases to happen in this direction, and then, without losing your grip and without sliding, nudge those wings of the sphenoid now toward the front of your face or towards your nose. Wherever you feel resistance is where you're going to wait for the releases to occur. And as it softens, then you'll nudge it a little bit further. After you find those wings, what you want to do is do the technique with your elbows resting on the table. So again, we're going to nudge back, wait for a few releases, and then without sliding, we're going to bring those wings of the sphenoid forward toward our front of our face or toward our nose.